So today's session is on how we'll approach to a case of poisoning. So from the theoretical knowledge which have been imparted to you when you were in the second MBBS, you have been told about different poison, what is a poisoning, and what are the diagnostic features, in general diagnostic features in a case of poisoning. So whenever any case of poisoning arrives to the emergency, it should always be considered as a critical state, and we should always take appropriate measures to address a case of poisoning. So there are different types of poisons. When you think about the term poison, it's something which is hazardous. It could be any drug. Say you have got an overdose with beta blockers, overdose with calcium channel blockers. You have an overdose of benzodiazepines, barbiturates, or it could be some chemicals, toxic chemicals, or even it could be of plant or animal origin. Whenever there is a bite by a snake, it could be a hemotoxic snake, it could be a neotoxic snake. Whenever there is a bite by a scorpion, sting by a scorpion, bite by venomous spider. There are various types of spiders which are venomous and they contain potential neurotoxins. There are even fish. We all like sea fish. It's not. There are sea fish which can contain very potential neurotoxins. There is a type of toxin which is present in pufferfish. Pufferfish and other types of fishes which are found in the sea, they can contain different types of toxins. One of the most prominent type of toxin is a tetrodotoxin, which is very harmful for our body. It will produce a state of paralysis, and it is very risky also. It can kill the person. So in a case of poisoning, it should be always considered as an emergency. So as soon as the case of poisoning comes, what are the duties of a doctor? Immediately when you are called to the ER, say you are a doctor working in the emergency medicine, or you are a casualty medical officer, first priority is to, before you go and touch the patient, is to take your personal precautions, because you do not know what the person has consumed or to what he has been exposed. So it is very much important that you take personal protective measures. You should wear a plastic apron, should wear gloves, should use a face mask. Okay. Preferably it is also important if you can have a face shield, or if you are wearing spectacles, fine. If you are wearing glasses, fine. Why I am saying this? Because whenever these patients come, they may present with vomiting. It's not it. Vomiting, they may be having epistaxis, they may be having hematemesis. So you do not know. They may be having hemoptysis. So the biological fluids, including blood, if it splashes on your body, on your face, etc., you may become susceptible to infections. It's not it, because you do not know the serologic status of the patient. And when you are wearing gloves and plastic apron, it protects you from unnecessary contamination. You should not touch the patient bare hand, because when you touch the patient bare hand, there is a risk that that particular toxic substance may come to you. Because inadvertently, when you use bare hands, you may touch, and later on, if you do not wash your hands immediately, there is a chance of absorption. It will get absorbed. But if you put your hand in your eyes, if you put it in your mouth, or if you have got a cut earlier on the previous day, and if you are touching, it can enter through that cut. So it is very, very important for your own personal protection. You are using gloves. Okay. So first thing in a case of poisoning is checking the consciousness. Is the patient conscious? Is he oriented? You can just simply tap the patient on the forehead. Hello, sir. Hello. So what is your name? What is your problem? So when you check the consciousness, you can find whether if he is conscious or is he completely obtunded. Obtunded means he is not conscious and he is not responding to you. And if he is able to respond to you, whether he is able to talk or not, or he is able to respond only through gestures. Whether if he is conscious, whether he is oriented to client-facing person or not. Because when you check his consciousness, you will check whether he is having delirium or not, whether he is hallucinating or not. Because there are various substances which can produce these features. Hallucinations, delirium. Delirium is a state of disordered orientation. Okay. Then you should quickly examine the eyes. Open the eyelid and try to see the pupils. Size of the pupil. Normally in light, the pupil measures 3 to 4 millimeter. In dark, however, the pupil can measure 7 to 8 millimeter when we are in the dark environment. Okay, because your pupil functions to control the amount of light which shall be entering into the eyes. Right. So when we are in light, pupils are 3 to 4 millimeter. So pupillary size is very important. You have to see what is the size of the pupil. Is it getting constricted or getting dilated? If it is constricted, if it is dilated, then in the differential diagnosis you have to keep the possible etiologies. Use of neonics or exposure to cholinergic drugs, cholinergic substances, in organ phosphorus poisoning, okay, in carbamide poisoning, okay, then even in exposure to nerve gases. There are nerve gases like serine, okay, and agent 15, which is actually a nerve gas used in